Welcome back to our channel Canadian Nurse Expert. In this session, we're diving into another set of mental health questions. These focus on real-world nursing scenarios involving anxiety, depression, schizophrenia, and bipolar disorders. Let's test your knowledge and build your confidence. A client with generalized anxiety disorder is having difficulty concentrating during a teaching session. What should the nurse do first? Your options are: ask the client to repeat the information, postpone the teaching session to a later time, provide written materials for the client to review later, assess the client's level of anxiety. Correct answer is assess the client's level of anxiety. Assessing the level of anxiety helps the nurse determine whether the client can participate in the teaching session or if interventions to reduce anxiety are necessary first. A client diagnosed with major depressive disorder says, "I feel like a burden to everyone." Which response by the nurse is most therapeutic? Your options are: you're not a burden, your family loves you. What makes you feel this way? You shouldn't think like that, things will improve. Have you spoken to your family about how you feel? The correct answer is: what makes you feel this way? A therapeutic response encourages the client to express their feelings, helping the nurse understand their perspective without judgment or invalidation. Moving on to next question. A client with schizophrenia states, "The government is spying on me." What is the most appropriate nursing response? Let's look at options. The government is not spying on you. Tell me more about these thoughts you're having. I understand you feel that way, but I don't see evidence of that. Let's focus on what you need to do today. Best option here is, I understand you feel that way, but I don't see evidence of that. This response validates the client's feelings without reinforcing delusions, maintaining trust while gently orienting them to reality. A client with bipolar disorder is in the depressive phase and refuses to get out of bed. What is the best nursing intervention? Now let's look at the options. Allow the client to stay in bed to rest. Firmly insist that the client gets up and participates in activities. Encourage small, manageable goals like sitting up in bed. Offer the client a reward for getting out of bed. In this particular scenario, the best option will be encourage small, manageable goals like sitting up in bed. Clients in the depressive phase of bipolar disorder may lack motivation. Setting small, achievable goals helps build confidence and encourages participation without overwhelming them. A client with a history of panic attacks asks the nurse how to handle symptoms when they start to occur. What is the most appropriate advice? Your options. Try to distract yourself by thinking about something else. Take slow, deep breaths and focus on your breathing. Ignore the symptoms, they will go away on their own. Immediately seek help from someone nearby. The best response or advice will be, take slow, deep breaths and focus on your breathing. Deep breathing helps reduce the physical symptoms of a panic attack by slowing the heart rate and promoting relaxation. Great work! Remember, mastering these questions is key to acing any competitive exam like NCLEX-RN. If you found this helpful, like, subscribe, and share. Let us know in the comments what topics you'd like to see next. See you in the next video.